In terms of that accountability, just how far short are we of expectations that we had with programs like COVAX for delivering vaccinations to lower income countries?
Yeah, we have definitely fallen short. COVAX is now at least 25% off their target. But I think the bigger issue is that we're learning so much about the limitations in manufacturing, everything from supply chain to actual physical manufacturing plants. And this brings up a very important issue. Can the fact that cases in India are decreasing actually free up some of that manufacturing capacity that we know India is known for? We know the United States has that manufacturing capacity. So we have definitely fallen short. We have more to do. I think that's why it's also important in the meantime. It can't happen overnight, Rosanna. So we have to have testing, treatments. We have a number of drugs that we've learned over the last 18 months that can help with COVID and prevent hospitalization, even in people who are not vaccinated. Those things need to be advanced quickly and swiftly, especially in countries with low vaccination rates.
Oh, absolutely. Dr. Patel, good morning. Thank you for joining in this conversation. What do you make of, what we are seeing play out in the U.S., the United Kingdom, also here in Singapore, in terms of living with the virus as vaccinations step up? There's all that talk about waning immunity, and at a time when the virus is still, very much there, up and active.
Yeah, it's very interesting. I've followed this kind of conversation, of course, in the UK, a lot of criticism for living with the virus. I think, Tanvir, we have to have an understanding of what living with the virus means. It does not mean taking away protections that could save lives, even amongst those who are vaccinated. We are now seeing higher cases of what we call breakthrough infections in vaccinated Americans. Not many, but that's why we're talking about the data for the boosters and having a national booster effort in many of these countries. I think that living with the virus in a situation where we have been unprepared for the virus, which I would argue, Tanvir, we still are in the United States today, is absolutely criminal. So we should not live with the virus unless we're prepared to have rapid testing available to all Americans, unless we're prepared to have easy access to treatments, even for people who are vaccinated and might get sick. And then finally, I will say this. We have to stop the debate over the value of masks in the United States. We need to have a more national approach. You just heard it from the UK that if they need to, they will resort to some of these measures. That's what living with the virus is. But I am worried that the world doesn't really understand what that means.